Hi, I'm Dr. Harish from Sukino. As a part of World Stroke Awareness Week, we at Sukino invite Dr. Chetan, an eminent neurologist with Manipal Hospital's Varthur Road, for a DocTok to understand the importance of stroke and its implications and ways of rehabilitation. Dr. Chetan has a special interest in stroke, movement disorders, epilepsy, and geriatric neurology. Welcome, Dr. Chetan.
Thank you. Thank you so much.
So, as a part of this stroke, how do you define stroke? What are the implications of stroke? And how does it affect? How important is it to diagnose it at the earliest?
So, hello everyone. First of all, stroke literally means out of the blue, all of a sudden. So, from the neurological perspective, any sudden onset neurological deficit is termed as stroke. For better awareness, for ease of communication, there's a mnemonic which we have created. It's called as B FAST, wherein B stands for balance, sudden onset walking difficulty, loss of balance. E stands for eyes, sudden onset double vision or loss of vision. F stands for face, wherein there is drooping on the face, one side gets deviated when they speak. A stands for arm strength, okay, when there is sudden onset weakness involving the hands, legs. S stands for speech, sudden onset speech difficulty characterized by slurring of speech, inability to speak or unable to understand what is being spoken. Now finally T stands for time. So without wasting any time, you have to reach out for help. So this is how you identify stroke, and once you identify the symptoms, don't go to any OPD or something, just reach out to the nearest stroke ready hospital. Now when I say stroke ready hospital, it means a hospital which has a facility to get an MRI or a CT scan done and which has an in-house neurologist who can interpret the report and give appropriate medications. So it's very important to recognize this symptom and reach the hospital on time. Okay, of late, since last many years, what we are seeing is the awareness about stroke is improving. People are getting to recognize the symptoms of stroke. But one mistake what they do is they identify the symptom, then they book an appointment with the nearest physician or their family doctor. Okay, by doing so, they lose a lot of time. For from a neurological perspective, time is brain. The more time we waste, the benefit from the medication which we eventually give is lost. Okay, as far as stroke is concerned, initial 3 hours is very, very, very important. We call it as the golden hour. That's when if we treat, the benefit is maximum. Slowly, the benefit starts waning off. Okay. One more important thing to understand why we focus so much on time and all that is, brain is a very, very sensitive tissue which cannot tolerate lack of blood supply for a long period of time. So once the blood supply is cut off, stroke basically is one part of the brain, the blood supply is lost. Okay, which is manifested with the symptom. Suppose the hand and leg area gets less blood supply, they present with weakness. Okay. So with every passing minute, millions of neurons are irreversibly damaged. Okay. So this can be prevented if the treatment is initiated on time. That's the importance of reaching the hospital on time.
Thank you for emphasizing the importance of time. Now, with due course, whenever time is lost, there is disability. How common are these disabilities and how do you define these disabilities?
See, disability is a rule in patient with stroke who hasn't got any treatment at all. Disability is a rule. Okay. Now, disability can vary. It's a spectrum. It can be as subtle as slurring of speech, or it can go up to coma, wherein the patient is not able to move at all. But most of the cases fall somewhere in between. Some people will develop some weakness. We call it as hemiparesis. They won't be able to grip well. They'll be able to move their limb, but they won't be able to grip well. They won't be able to walk properly. This is one form. The other form of disability comes in terms of communication. There's an important area of the brain which manages the language. We call it as Broca's area and Wernicke's areas technically. So if the blood supply to that part of the brain is affected, one is they won't be able to speak. The other thing is they won't be able to understand what is being spoken to them, which is a bigger disability. Right. So it brings in a lot of frustration to the patient. Apart from this, there are sensory impairment. If the sensory area of the brain is affected, they won't be able to feel anything in the affected side. So disability, as I said, it's a spectrum. It can be mild, it can be moderate, it can be very severe, which can make a stroke patient bedbound.
Good that you explained that in such a detail about the spectrum of illness that can happen, the disabilities. Now, once disability has set in, how important is it for rehabilitation to recover from stroke?
treatment of stroke, again, there are multiple levels of treatment. Initially, the treatment which happens over the initial 1 week is to ensure that the damage is restricted. There is no reoccurrence of stroke, because stroke recurrence is very common in the initial 1 week. So we give medication for that. And finally, when we discharge the patient, we discharge them with certain medications. Okay, the medications ensures that there is no recurrence. But more important than that is rehabilitation. Okay, now again, the kind of rehabilitation which we recommend to the patient again depends upon the disability he has. If it is subtle slurring of speech, we don't do anything. We teach some speech exercises and we send them. If the weakness is severe, then rehabilitation is extremely important. Okay, I say this because there's something called as neuroplasticity. Okay, so the brain, the part of the brain which is affected, the surrounding brain tissue starts to pick up those function, which is possible if a good neurorehabilitation is done. That's why we recommend a rehabilitation.
Now that you have explained to us the importance of rehabilitation, how long would, on an average, would a person require rehabilitation? What kind of rehabilitation is available for people who have sustained stroke? And to what kind of patients do you recommend this kind of rehabilitation processes?
Yeah, as I said earlier, rehabilitation is a very important part of stroke recovery. It is as important as the medications we give. Rehabilitation again depends upon the kind of stroke patient has, the severity of disability, and the kind of job he is doing. If it's a young patient who has suffered a stroke, who is being employed, then rehabilitation becomes even more important so that he's able to do his job well. Okay. For some kind, as I said, subtle stroke, mild weakness, there are some exercises which teach them on OPD basis. They don't require such rehabilitation. But there are people who develop complete weakness. For them, it is very important. As far as the recovery is concerned, it takes, on an average, for all this mild to moderate stroke, 6 weeks to 6 months is a broad time frame which we give. It can be lesser than that as well. Last week we came across a patient who recovered in 2 weeks because his weakness was subtle. They presented to the hospital on time. They got full benefit of the medications. For some people, it can be a long drawn process. Okay. So recently we came across a patient, who was having a very massive stroke, which forced us to put him on a ventilator. He was on a ventilator for quite some time. He was extubated. He was taken out of the ventilator. He was comatose for quite some time. Then we shifted him to the rehabilitation facility. It went on for for a few months. Then gradually we started seeing improvement. Okay. So as I said, improvement can take 6 weeks to 6 months for average moderate size stroke, but it can run into years for patients who have had a major stroke. That's the reason we are so particular about awareness about stroke symptoms.
So it's pertinent to know that stroke patients need a personalized and customized rehabilitative recuperative care to have the best possible outcome. Thank you, Dr. Chetan. Following the treatment of stroke, you continue to monitor your patients during the rehabilitative phase. How do you help them choose an appropriate rehabilitative process?
See, follow-up during the rehabilitation process is equally important. One is we'll be able to assess the improvement what the patient is having. If there's any particular deficit, which we want the neuro rehab team to work on in particular, we can communicate it to them. The other thing is compliance is ensured. When the doctor is seeing the patient is reinforced to take the medications and follow the rehabilitation process. The third thing is identify complications. Okay, people following stroke have one set of complications, There's something called as spasticity which sets in. For example, someone is having a weakness on one side of the body. It tends to get tightened, You would have seen this posturing in people with stroke who haven't undergone a good physiotherapy. So such things can be identified and managed with medication, which will further help the rehabilitation process. The other thing is seizures are pretty common following a stroke. So if at all any such thing is there, it will be brought to our notice, then we'll be able to treat it accordingly.
Now that you've been following your patients for about several months following stroke, especially when they undergo inpatient rehabilitation also, can you share some good success stories that you have seen in this kind of patients?
Yeah, there are quite a lot of patients who have recovered very well from stroke. Okay, so rehabilitation, as I said, it's important. In certain cases, we recommend the inpatient rehabilitation. Okay, because see, managing people with stroke at home is difficult. There's something called as family, caregiver fatigue, and patients tend to take their own family members for granted. So they might not comply with all the exercises, and the family members won't be able to give complete attention. So wherever possible, there are certain extreme cases wherein we feel neuro rehab will definitely be helpful. We refer it to such a facility. And one more thing is, why it helps is there are numerous things, when we talk about physiotherapy to patient, one common understanding is just move your hands and feet like this, recovery will happen. But no, there are a lot of other things, other fine details which a professional will be able to identify, okay? As to, there is some writing exercises, there are speech exercises, language, swallow exercises, which probably the family members won't be able to do effectively, especially during the immediate post-stroke period. Over a period of time, the family members also will learn about it, and once the recovery is there, the patient will be, more motivated to follow all those exercises. So yeah, this is one thing. The other thing, regarding the success stories, very, heartening to see such people come back without any deficits. Recently, hardly 30-year-old male, he woke up in the morning and he was not able to speak at all. Okay, and somehow his wife identified it and immediately brought him to the neurology OPD. Luckily, the OPD was empty. He was the first patient I saw. Immediately, we took him to the emergency MRI. MRI showed a huge stroke involving the language area. This is what his major symptom was speech. The other problem was weakness involving lung side. We immediately identified the stroke. There's something called as clot buster we give, which helps in opening up the clots. So we gave that injection, and over a period of next 2 to 3 days, there was some recovery seen. We discharged him, and maybe 2 to 3 weeks following discharge, he was more than 50% better. And going forward over the next couple of months, I'm sure he'll reach at least 90 to 95% of his initial neurological status. So it's very heartening to see such cases.
It is a multidisciplinary team approach. Usually under the guidance of the neurologist, we at Sukino have a team of physiotherapists, occupational therapists, respiratory therapists, speech and language pathology specialists who work under the guidance of the neurologist to take care of them. We do have some clinical milestones, like especially people at the other end of the spectrum who have the tracheostomies and the feeding tubes. These are all called clinical milestones where we are able to take them off these indwelling urinary catheters also. So it brings us that amount of confidence when we have the primary neurologist guiding us during the process of rehabilitation, right? How important is it to have the involvement of family members in the rehabilitative process?
See, the family members are the most important people, when it comes to post-stroke recovery, because for a patient it is really frustrating, okay, to become immobile and lie down on the bed. Family members ensure that the patient is motivated. They ensure that there is good compliance with medication. They also, look out for any warning signs and immediately, inform us so that appropriate corrective measures can be taken. For example, bed sore is a very common complication in people who are bedbound. Seizures, as I said, there can be subtle seizures, which can be missed sometimes. Family members identify and bring it to our notice. And there are certain other things like stiffness. They say that hand is getting very stiff. Do we need to do something, So such things, family is the most important part of stroke recovery. And what we see is people with good family backup, they eventually do well. The long-term prognosis is usually good for such people.
With especially this upcoming stroke week observation, how do you combat stroke? What are your recommendations on the whole and the takeaway message for our viewers?
Combating stroke, it's a very broad thing. There are multiple aspects involved here. Stroke, as I said, it's a vascular disease. Okay, it's the blood vessels which supplying the brain gets affected due to some reason. Okay, there is accumulation of clot, okay, which tends to block the blood flow and cause stroke. So there are certain risk factors which we know of. Okay, as we all know, hypertension, high blood pressure, diabetes, which is uncontrolled, elevated cholesterol levels. All these are common risk factors of stroke. So we need to optimize our lifestyle to avoid all such risk factors. If you are already having this illness, make sure that you are under periodic follow-up and all the parameters are under control. If you don't have this, make sure that you do all the things which is required to avoid these diseases. One thing which is very important, especially for our generation, is to stay mobile. Don't sit at a place for a long period of time. Keep a watch on what you have. Okay, food is very important. Avoid excessive carbohydrates, avoid excessive junk food. All this cheese and all this oily food needs to be avoided. Sleep is the most underrated physiological function, which is often neglected. A lack of sleep or a disturbed sleep or suboptimal sleep is linked to so many diseases. With respect to stroke, there's something called a sleep apnea, again underdiagnosed disorder, which is contributing to so many illnesses. We see a lot of patients with hypertension, young patients with hypertension, finally turning out to be sleep apnea. So we need to take care of all this. Apart from this, it's always important to have a good exercise regime. Make sure you are active for at least 30 to 45 minutes per day. Make sure you focus on all this cardio exercises. Yeah. So apart from that, identify, if at all you have those symptoms yourself or you see any of your family members, identify the symptoms and take them to the nearest stroke ready hospital. So that will go a long way in preventing the complications of stroke.
Thank you very much, Dr. Chetan, for your very valuable and comprehensive message to all our viewers. I'm sure our viewers will benefit a lot from this and get to avoid stroke as much as possible. Thank you.
Thank you.